Hello everyone, welcome back to my channel. So from today we will start periodontics and we will do all the chapters of periodontics from Dental Pulse. So the first chapter is gingiva and tooth supporting structures. So let's begin. So question 1 is stippling is seen on. So its answer is attached gingiva. Its answer is option B, attached gingiva. Explanation है stippling is seen in attached gingiva and central core of interdental papilla. It is absent in marginal gingiva. Stippling is a form of adaptive specialization or reinforcement for function. It is produced by alternate rounded protuberances and depressions in the gingival surface. Stippling is a feature of healthy gingiva. Loss of stippling is reversible and is a common sign of gingival disease. Stippling is absent in infancy and in old-aged people. It appears in children about the age of 5 years. Okay, so the answer is attached gingiva. Now question 2. With the increase in age, keratinization of gingiva, it increase, decrease, remains the same, or increases and then decreases. So its answer is option B, decreases. Explanation है with the increase in age, width of the attached gingiva increases, number of elastic fibers in the periodontal ligament increases, number of collagen fibers decreases, and keratinization of gingiva also decreases. Okay, the decreasing order of keratinization in different areas is palate, which is most keratinized, then gingiva, then tongue, then cheek, which is least keratinized. Okay, now question 3. The color of gingiva is due to option A, capillaries, option B, thickness of epithelium, option C, thickness of keratinization and pigmentation, option D, all of the above. So its answer is option D, all of the above. Color of gingiva is due to capillaries, thickness of epithelium, thickness of keratinization and pigmentation. All the three are true. Now question 4. Most periodontal fibers are activated when resisting torquing forces, horizontal forces, vertical forces, or sliding forces. So its answer is option C, vertical forces. Explanation है oblique fibers, the largest group in the periodontal ligament, extend from the cementum in a coronal direction obliquely to the bone. They bear the brunt of vertical masticatory stresses and transform them into tension on the alveolar bone. So most periodontal fibers, that is the oblique fibers, are activated when resisting vertical forces. Now question 5. Dentogingival unit comprises of. So the answer is option B, gingival fibers and junctional epithelium. The attachment of the junctional epithelium to the tooth is reinforced by gingival fibers. Therefore, the junctional epithelium and the gingival fibers are together considered as dentogingival unit. Now question 6. Free gingival groove represents option A, histologic depth of gingival sulcus, option B, depth of gingival sulcus, option C, false pocket depth, or option D, none of the above. So its answer is option A, histologic depth of gingival sulcus. Okay, explanation है histologic depth of the gingival sulcus is 1.8 mm. Probing depth of the normal gingival sulcus is 2 to 3 mm. Okay, so free gingival groove represents histologic depth of gingival sulcus. Now question 7. Stippling is absent in option A, infants only, option B, older men, option C, children, or option D, both infants and old. So its answer is option D, both infants and old. We have studied about it in the question number 1. Okay, so its answer is both infants and old. Question 8. Junctional epithelium is attached to enamel by, so its answer is C, hemidesmosomes. Explanation है, junctional epithelium is attached to the tooth by the means of hemidesmosomes. Keratinocytes are connected to one another by option B, that is desmosomes. So junctional epithelium is attached by hemidesmosomes, and keratinocytes, these are the cells of the gingiva, are connected to one another by desmosomes. Now question 9. Which type of cells are most numerous in gingiva? Option A, melanocytes, option B, keratinocytes, option C, giant cells, or option D, polymorphonuclear leukocytes. So its answer is option B, keratinocytes. Explanation है, keratinocyte is the principal cell of gingival epithelium. Melanocytes, Langerhans cells, and Merkel cells are the non-keratinocytes. So what are melanocytes? These are dendritic cells located in the basal and spinous layers of gingival epithelium. They synthesize melanin in melanosomes. What are Langerhans cells? These are the dendritic cells located among keratinocytes at all suprabasal layers. Absent in the junctional epithelium of normal gingiva, they act as antigen-presenting cells for lymphocytes. They contain G-specific granules, that is Burbeck granules, and they have marked ATP activity. What are Merkel cells? These are located in deep layers of epithelium and harbor nerve endings. They serve as tactile receptors. Okay. So some other questions are also asked. Amongst the non-keratinocytes of oral epithelium, the non-dendritic tactile sensory cells present in the basal layer, so these are Merkel cells. Burbeck granules are seen in, so answer is Langerhans cells. So most numerous cells in gingiva is keratinocytes, which are attached to each other by desmosomes. Now question 10. Gingival caul is, so option A, orthokeratinized, option B, parakeratinized, option C, both, or option D, non-keratinized. So its answer is option D, non-keratinized. So explanation है, interdental caul is area of periodontium more susceptible to tissue breakdown because it is thin and non-keratinized. It is the site where oral hygiene accessibility is not possible. It is the area of food entrapment. Junctional and sulcular epithelium are also non-keratinized. So gingival caul is non-keratinized, and junctional and sulcular epithelium is also non-keratinized. Question 11. Gingiva is supplied by, option A, supraperiosteal vessels, option B, subperiosteal vessels, option C, apical vessels, option D, all of the above. So its answer is option A, supraperiosteal vessels. The three sources of blood supply to the gingiva are supraperiosteal arterioles, vessels of periodontal ligament, and arterioles that emerge from the crest of interdental septa. Okay, these are the three sources of blood supply to the gingiva. Now question 12. The junctional epithelium is attached to the tooth by, so its answer is option A, basal lamina. Explanation is, the junctional epithelium is attached to the tooth by means of internal basal lamina and to the gingival connective tissue by means of external basal lamina. The internal basal lamina contains lamina densa and lamina lucida, to which hemidesmosomes are attached. Now question 13. A curvature of gingiva towards the root found in the middle of the interproximal area between molar is termed as, option A, caul, option B, self-cleansing area, option C, interproximal embrasure, option D, cervix. So its answer is option A, caul. Explanation is, the interdental gingiva occupies the gingival embrasure, which is the interproximal space beneath the area of the tooth contact. It can be pyramidal or can have a caul shape. In the former, The tip of the papilla is located immediately beneath the contact point. The latter presents a valley-like depression that connects a facial and lingual papilla and conforms to the shape of the interproximal contact. Interdental caul is most prone to infection. Okay. Now question 14. The length of junctional epithelium is? So its answer is option A, 0.25 to 1.35 mm. Junctional epithelium is a collar-like band of non-keratinizing epithelium. It is 3 to 4 layers thick in early life and increases to 10 to 20 layers with age. Its length ranges from 0.25 to 1.35 millimeter. Okay. Now question 15. Least width of attached gingiva is found on the facial aspect of? So its answer is option A, first premolar. Width of attached gingiva is greatest in the incisor region, okay, and least width in the premolar region. So in maxilla, width of the gingiva in the incisor region is 3.5 to 4.5 millimeter, and in mandible it is 3.3 to 3.9 millimeter. And least width in the first premolar region in maxilla is 1.9 millimeter, and in mandible is 1.8 millimeter. Width of the gingiva, attached gingiva, increases with age and in supra-erupted teeth. Now question 16. All the following cells of the periodontal ligament are resorptive cells except option A, fibroblast, option B, cementoclast, option C, odontoclast, or option D, osteoclast. So its answer is option C, odontoclast. Cells of the periodontal ligament are divided into three categories: synthetic cells, resorptive cells, and epithelial rest of melisses. So synthetic cells are osteoblast, fibroblast, and cementoblast, and resorptive cells are osteoclast, fibroblast, and cementoclast. Question 17. The V-shaped space that encircles the tooth and present between the tooth and the gingiva is called as? So its answer is gingival sulcus. Option D, gingival sulcus. The gingival sulcus is the shallow V-shaped space or groove between the tooth and the gingiva that encircles the newly erupted tip of the crown. It is in the fully erupted tooth only the junctional epithelium persists. Now question 18. Normal consistency of the gingiva is? So option A, soft, option B, hard, option C, firm, option D, firm and leathery. So the answer is option C, firm. The consistency of gingiva is firm and resilient. It is due to its collagenous nature and its contiguity with the mucoperiosteum of alveolar bone. Now question 19. After the tooth emerges to the occlusal plane, the clinical crown height increases by? Option A, passive eruption, option B, active eruption, option C, post-emergence growth spurt, or option D, juvenile equilibrium. So its answer is option A, passive eruption. So explanation है, active eruption is movement of teeth in occlusal direction, okay, and passive eruption is the exposure of teeth by apical migration of the gingiva. So answer is passive eruption. Question 20. Gingiva in children: more keratinized, more stippled, more keratinized, less stippled, less keratinized, more stippled, or less keratinized, less stippled. So its answer is option D, less keratinized and less stippled. Summary of periodontium characteristics in children. So in gingiva, the gingiva is less stippled, redder than adults due to increased vascularity, interdental caul formation and saddle areas, thinner, less keratinized epithelium, affinity for melanin pigmentation. Attached gingiva is narrower in primary dentition and narrower in the mandible. Interdental papilla is shorter and rounder. And what about PDL and bone in children? The children have wider periodontal membrane space, fewer and less dense periodontal fibers, less dense and differentiated collagen fibers, increased blood and lymphatic supply, thinner laminar dura, flatter alveolar crests, and fewer trabeculae. So we have done 20 questions of this chapter, and the remaining question will be solved in the next part. So stay tuned, and if you like this video, do like and subscribe to this channel. Thank you so much.